Okay. Hi, everybody. We are back.
We're back.
Dr. Sean and Kevin.
Welcome back, Kevin.
Good to see you, man. How was Mexico?
Mexico was awesome. We had a great time.
Excellent.
I practiced a lot of breathing while I was there.
Oh, perfect.
Yeah. How was your surgery?
It was good, actually. It was good. I have a whole new belly button.
Yeah, and an implant. I won't tell you where. But
So, had a little hernia surgery. Boys are having fun with that. Back in action again.
Hernia surgery.
Next week.
Kevin's been off all week sleeping and
And breathing.
Breathing.
That's what we're talking about today. So for those of you that forgot how to breathe, that's what we're talking about today. Which, it's funny to say that, but tons of us do forget to breathe properly. And we wanted to just explain today, what's the importance of doing that? What does it bring to you? How can that help you?
Yeah, physiologically, how can it help
Yeah.
you?
So why don't we start off with that? Boom. Why would you take the time to consciously breathe every day?
Okay, so let's
Right?
Oxygen.
Big
It's
one.
probably the most
Big one.
important. I think it is the most
Keeps us alive.
Keeps us alive. It's the most important element, essential for our well-being, our thriving, and optimal health.
So Scotch.
That's doctor's orders, by the way. So he was allowed to take it easy this
It's a
week.
natural painkiller.
So oxygen, right?
Yeah.
You can go, I think, 7 minutes without oxygen, and then you're done. You can go, I think, 7 minutes without oxygen, 7 days without water, and I think 30 days without food.
Yeah.
Right? So oxygen, in terms of importance, is the most important. Then it's water, and then it's actually sodium. It's salt. Right?
Yeah.
So for what your body needs to thrive and function. Hey, Steph.
Oh, Steph is here. So obviously, oxygen aside, why would we maybe what we could talk about is we tell our patients all the time about this.
Yeah.
So the bigger reasons are, one, to help the healing process. But we
Cells
have
thrive on oxygen. Right?
Yeah,
So if you can better oxygenate your body, your blood, your cells will love and thank you, and you'll heal better.
Well, they'll be more optimal. That's what they thrive on. So it's very, very important to saturate the body with as much oxygen as we can. And we often get in either situations where we're stressed, where we're preoccupied, where we're physically stuck, and we can't breathe optimally. So then what happens is you start diminishing the amount of oxygen you have. So brain activity diminishes, to energy levels, to the way you heal, to even being, centered. So if
That's
we're
a huge
thinking
one.
on a mental or spiritual aspect, people do this on a regular basis to get themselves back in line again with what they're wanting to achieve and bring themselves back into their body, because we often get stuck up in our heads.
Yeah.
Right?
So even let's take it back a step. Even having experienced two births, and one being able to deliver, actually guide my son into this world, and to see the first breath of life was it's insane how connected we are to this element, to oxygen. And Kev has three young girls, and it's so powerful a moment to realize how important oxygen is to us as human beings and our world, right? To our entire environment. So
I think too, a lot of people, you can see from people's reactions sometimes, they're like, I'll do it, and it's like the importance of it, or the relevancy of doing it more frequently properly, doesn't seem that. But it's like anything else, right? Like the application of it on a regular basis, which we'll talk a little bit about Wim Hof later, is amazing. On a physical level, on a mental level, focus level, unbelievable.
Yeah. So physiologically it's important. Spiritually it's important. Stress, anxiety, everything. The power to breathe, or to breathe more effectively. So let's talk about that. We as clinicians, what would we look for, or how can we help you breathe better?
Right.
So we would look for, when we evaluate, we would look at the rib cage. We look at the alignment of the body. We'd look at the alignment of the rib cage with respect to the hips and pelvis. We'd look at the nerve supply, so the phrenic nerve, the innervation to the diaphragm. We'd look at all the muscles, the primary muscles, the secondary muscles of respiration. We'd evaluate all that. We'd look at it for tension in different zones. We'd look at it for restriction in different zones.
Osteopathically, we'd look at the mobility of the lungs. All the internal lining of the rib cage, like Sean was mentioning before. There's a lot of things that come into play that could actually inhibit
your capacity
to breathe
and to oxygenate. So that's awesome, right? So that's what we
most classic one would be like the patient we see the most is the office worker sitting
posturally,
posturally, and just squishing down all the time in front of a desk. You're completely shutting off the diaphragm, creating this accumulation of tension there that then later, a certain amounts to something that's a little bit more problematic. So that alone, just getting that to pump better is huge for blood flow, for everything, digestion, all those angles.
It's crazy. It's endless, the implications of proper breathing. So where do we go wrong, right? Well, why does breathing, like we talked about our kids, and I watch my baby. He has this beautiful diaphragmatic breathing, just laying there, and big expansion of the belly, and so he breathes deep into every aspect of his lungs, and it's innate, right? It's innate. We're born with it. So then why do we lose it? What are some things
what I see the most is like what we mentioned before. I think mental stresses. It's our nature. Like our nervous system is designed to respond to fear. Right? So whether it be now fear from work, having to do a deadline, to am I going to get fired? Oh my God, I have too much work. The kids, that all these things create this state where we're almost like holding our breath, waiting for something to happen. Mm-hmm. Now, the key thing, like we say a lot in clinic, is we have to learn to breathe through this, to live through the event, not to shut our blinders on it. So a lot of people will shut that down in those circumstances.
Yeah, so stress, right? So stress, anxiety is a factor that
limits it.
That limits our capacity to breathe well. And again, that ties into a lot of different elements, right?
You can tell, right? Like you can tell when someone's either stressed or not doing well, the way they hold themselves.
They're closed in.
They're always kind of like just protecting themselves, crossed-armed. All these things are indications that someone is having some internal kind of struggle. Yeah. But it could be also they had an accident.
Yeah, it could be physically
whiplash.
Yeah,
because it could be stress on the phrenic nerve.
Exactly. So that's why it's important to evaluate these zones, which are associated with vital lung capacity in your body, in your ability to kind of fully expand and fill your lungs. So like we say, the thoracic cage, the rib cage, the articulations, the joints between the costovertebral, right? So your ribs, how they attach to your vertebra, your ribs, how they attach to your sternum, the fascia, the musculature in and around. So there's like primary muscles that are involved in respiration, and then there's secondary muscles. Addressing those, see if they're hypertonic or hypotonic. Yep. That's ways of optimizing the mechanics of breathing, like Kev mentioned, the actual lung itself and the tissues in and around, and then the nervous system, right? The innervation of those structures or those tissues. So that's of the utmost importance. That's what we would evaluate in here, right?
Yeah.
That's how we would help you guys breathe better.
So what would be some things then, Sean, that you give to patients as like, let's say if we get into now, okay, we know what it can do, we know the benefits of it, both mentally, physically, physiologically.
So number one, I would try and teach a patient how to breathe properly.
Sure.
So just reconnect them with the actual, and we do this all the time. You do the same thing where we're just kind of feel your chest and then feel your belly. And when you breathe in, if you feel your chest expanding first and instead of your belly, we're doing it a little wrong, right?
A little more shallow breathing.
A little more shallow breathing. We call that actually chest breathing or apical breathing or clavicular breathing because you're breathing up here.
Yeah.
But where this ties back to neurology, that's actually a sympathetic breathing or a fight or flight breathing, right? Yeah. So that's stress, right? So if you breathe in that zone, it's like a catch-22 because you're stimulating that nervous system,
sure,
and you're in a more anxious or stressed state just by breathing up there. right?
Yep.
So number one thing I always look at, just trying to teach people how to breathe effectively. So to lay down and just really practice breathing deep into your belly or into your diaphragm and feeling the base of your lungs and your belly expand, right?
What I'm trying to be more specific about with people and myself is breathing in
360 degrees.
360 degrees.
Yeah.
So people will lie down and just alone to get them to breathe and say, like Sean was saying, belly out first, chest second, and then back down, and you start over again. Well, you should be thinking of also pushing out the sides and through your back, so your lungs almost are expanding everywhere.
Your lungs are lower at the back, right? They actually go way down back, right? So we want to access that area of your lungs, right?
Yeah.
So that's really good. That's an awesome point, Kev. So 360 degrees. So expanding the belly, but also, visualizing that you're expanding through, your flanks, your low back, right?
Yeah.
That in a nice safe setting. So laying down is just to practice a few deep belly breaths like that is a great place to start.
And one of the benefits from this, which I learned from a good buddy of mine, Scott Livingston, is the you actually reset the proprioception of the muscles of the back by doing this also. So meaning, people that are having back spasms or all this back tension, by breathing like that, you're actually helping that musculature reset itself. So it's not always grabbing.
Yeah.
So it's very, very important for many, many things, but that being one huge one. So that's exercise one. You just start you could be on your back, knees bent, or and just try and take those deep breaths in, make them a little fuller and normal.
You can do these anywhere. You can do it sitting. You can do it
at your desk.
The important thing
you could do those sitting.
The important thing is doing it, right? Just being more conscious of your breath.
Even if it's 5 minutes,
5 minutes. Even if it's 5 deep breaths, right? They can it's an amazing tool that once you start to use and once you start to understand and once you're conscious of,
you'll feel the difference physically too, right?
Oh,
so you start seeing where you're tense, where you're not. So people get really good at starting to feel their body more, and they're less kind of always in their mind all the time.
Yeah, and then in a more advanced way, actually directional breathing, right? So once you've got that, you can then direct the breath into the area that's bothering you or into the zone of your...
Well, which they use, you often hear that when people are stretching, right? Mm-hmm. Or doing any type of mobility work, to really try and focus your breath on the segment you're working on to expand in that area. But you can do like the same thing you said. The same thing is directing breath into a zone where you have pain is equally beneficial at diminishing that discomfort and helping the area become more supple.
Awesome.
So those are two exercises. One that Sean and I do often is there's a Wim Hof, who is a pretty interesting guy that's in Amsterdam.
He's in Amsterdam, I think.
Very, very cool guy. He talks about the benefits of breath work on the autonomic nervous system. So he's talking exactly how to regulate yourself better through breathing.
Through breath work.
And it's like how much do you vibrate when you
Kevin
and
I we've done this this
crazy.
course for past little bit now, couple years now. When we first kind of fell on this guy Wim Hof, I'd done some other really cool breathwork seminars. This guy Denis Willett, I give a shout out to this guy. He's an American guy. Integral breathwork is his stuff, and he has a very, very similar. It's almost power breathing. So these are again advanced techniques, but they're amazing.
For different outcomes,
right? Because breath work can be used for a number of things.
You can do, like you said, we can do the initial one to relax and bring the system back down, which a lot of us need.
Yeah. Because we talked about the sympathetic. So breathing up here is very sympathetic, right? We have two nervous systems that regulate us, right?
Yeah.
Balance. We're always talking about balance. One is sympathetic, which is fight or flight, excite, and the other is parasympathetic, which is rest, recovery, feed, breed, right? So we, unfortunately, Western world, we're running around here. We want to bring it back down here.
Yeah.
So by belly breathing, Kevin mentioned it, you're centered. You're within you're instead of being up here or here, you're right in your body. But that actually stimulates your parasympathetic nervous system. So that allows you to come back to
better sleep, level. Better digestion.
It's ridiculous, everything, right?
More regulatory functioning is better. And then the opposite side would be something a little bit like Sean was saying, a little bit more invigorating, which there's breath work where you go quicker in order to stimulate the system so that it can perform better. So these are two different things, but I think for these purposes, we can get into the calming effect.
Yeah, and then you know what? I love this subject, and I think it's an important one. So I I would love to do some more
Sure.
on this. I don't know if you guys are interested in it as well, but give us some some feedback, some questions, some comments below. Let's just recap a little bit what we talked about today. So we talked about breathing, oxygen, the essential element of life.
Benefits for the brain.
The brain,
right?
the
benefits for
every
reducing
cell in your body,
adrenal gland activation. That's through the roof. So meaning stress level,
right? So
reducing stress hormone, increasing testosterone,
Yeah.
all these things that can
balancing the body, right? Alkalinity actually, when we talk about acid-base balance. So really, when you breathe efficiently, effectively, you actually help that balance as well.
Yeah.
So that's an important thing. So physiologically, it's ridiculous what we do. What happens to the body when you breathe?
Yeah.
Right?
And then the 3 exercises, or 2 in essence, would be just the basic breathing, starting to breathe through the abdomen to get everything going, breathing out your back.
360 degrees.
Always. And then the second was making sure that you're making it a common practice that's consecutive, consistent in some sense, because and if you want the work to be done, it has to be it has to be consistent.
Yeah, and it's the awareness, right? So if you try and catch yourself throughout the day and be like, oh, I'm not breathing.
I'm not breathing. Yeah,
I sometimes when I'm treating patients, I'll be like, "Ooh, Sean, I got to breathe," because you get into what you're doing, but we're better practitioners when we're breathing, right? We're more in tune, we're more there, we're more focused, we're more present. You feel more. So we're continuously working at this. We're not perfect by any means. This is like an evolution, right? So it's so important. This is amazing.
We'll come back to this one. Should we talk about the project we were discussing through text the other day?
A fun thing that we were thinking about doing is doing kind of like a round table with you guys, so on different topics.
I don't know if anyone's seen House before, but it made me think of it, where we could have potentially have a round table of our team here, and do mock scenarios of what we do in clinic, where we talk about a case. So we want to know from the physio's point of view, from the osteopathic point of view, from the chiropractic, applied kinesiology point of view, or massage, what is the best line of action for this particular problem and patient. So what we want people to do is, if you have an issue that you want answers to, is send it in, and we will answer that in a group format. So we're going to be the gang trying to get together and discuss this case and come up with the best vision on how to treat that.
Yeah, I think it's awesome.
So that's cool. Some new stuff to come.
So guys, as always, we want to say thank you for tuning in. Thanks for sharing our video with people. If you find it interesting, the questions, comments, keep them coming, because we love the interaction.
Throw us off guard.
Throw us off
something
guard.
Interesting.
And don't worry, he's gonna be okay. His surgery was successful. It was very, very minor surgery.
Yeah, very minor.
I don't think he needed to miss a week of work, but
doctor's orders.
Good
patient for once.
So thank you so much.
All right, guys,
this was fun.
We'll talk to you next week.
I like seeing this guy again. I was happy to come back from Mexico, but we will talk to you guys soon.
All right, guys, thanks.